In this video, we're going to talk about sleep apnea and how we can help you. Generally, the first step or treatment is the diagnosis, is to ensure that you are indeed snoring and you are indeed suffering of sleep apnea. So generally, the patient will be referred to have a sleep study. Sleep study nowadays can be done in a hospital. It can be done at home setting. That's the type of study that we actually provide to our patients here when they're referred by a GP. We as dentists, we see a lot of patients. We are certainly examining people hundreds of times a day, and we can see signs that would indicate an increased risk of apnea and snoring in people's mouths. So although we are dentists, we certainly have quite a bit of experience, and we are able to at least assess a patient and have a pretty good idea whether they are at risk of having apnea or not. Snoring, of course, is something that people know about because their partners will tell them. They wake themselves up at night. Sleep apnea, sometimes people will be aware of it, sometimes they won't. And I think those are the dangerous cases, because people could be going on for years, sleep apnea, undiagnosed. And nowadays we know so much about sleep apnea, how it increases the risk of heart disease, how it increases the risk of a number of conditions. And if you got apnea, you don't know, this could be potentially affecting your health in a pretty big way. We still prefer that a patient sees his GP first. GP then will make a more complete assessment of the patient's health. They would then refer the patient to have the sleep study, which could be done here if we have a referral. Then we would have the sleep study. We can organize it for the patient. Patient goes home, has a sleep study. We get the results back within a week or so. And part of the results will be a recommendation from a sleep specialist of whether that patient does have apnea or not, what level, if it's mild, is it moderate, is it a severe case, should we be sending them off for a consult with a sleep physician, or is it something that we can treat here? So pretty straightforward. The patient will come in, they would spend about half an hour or so with one of our staff. They will teach the patient how to set himself up at night. You go home, put on your pajamas, and then you pretty much just hook a few clips, a couple of little adhesive patches, strap around your chest, and go to bed. So it's as simple as that. It records the way you sleep at night time. It's a pretty comprehensive assessment. So it records things such as whether you're snoring, how loud you snore, whether your legs twitch, whether you sleep on your back, sleep on your side, whether you stop breathing, and that's the apnea. So whether you stop breathing, how often you do it, for how long, so the brain waves. So there's quite a lot, very comprehensive. It's a very interesting study to look at. Once the sleep study is completed and patient comes back and we download the data and send it off to the sleep study center, that's where they will assess all the data and come up with a diagnosis. So that's done by a sleep physician, a specialist doctor. And the sleep physician will then give us a report. So that will go to the patient's GP. That will come to us as well if we request, if the patient authorizes, of course. And in that report, there will be recommendations of what treatment we should try. So as dentists, we're in a pretty good position to provide patients with an appliance called a MIS, or a mandibular advancement splint. So what that is, it's a type of mouth guard. It clips on top and bottom teeth at the same time. You pop it on at night before you go to bed. And what it does, it changes the position of your bottom jaw. So it just pushes your jaw forwards a little bit. It opens the airway, allows you to breathe a lot better. So by changing the jaw, pulling the muscles forward, you create a wider opening in the airway on the back of the mouth here. They're quite effective. They're not for every case. There are cases that are more severe. A mandibular advancement splint will not be enough. So those are cases where perhaps the patient would require a CPAP machine and some other devices. But that's the sort of thing that then we would be discussing in conjunction with the patient's general practitioner or even sleep physician. So click the like button if you find this video useful. Don't forget to comment and subscribe.